This is a patient who comes in with abdominal pain, and we get a CT scan with intravenous contrast. As we scroll downwards, we'll start to notice when we look in the mesenteric area, there's a mass within the mesentery. If we look at it more closely, we notice that it's a soft tissue mass. It has these spiculated margins, almost like it's tethering the adjacent loops of bowel, and certainly some of the vessels adjacent to it also look like they're tethered to this mass. And so whenever I see a tethered mesenteric mass, one of the things I think about is whether this could represent a nodal metastasis from an underlying carcinoid tumor in some of these adjacent loops of small bowel. Now, identifying that small bowel tumor can be challenging, but certainly you have to look, and sometimes you can look and get lucky and the bowel is distended enough you can identify the actual culprit. And in this case, if we look at some of the adjacent loops of bowel right around there, you can see that there's this soft tissue mass within this loop of bowel, small bowel, that is in close vicinity to this nodal mass over here. And so this turned out to be a carcinoid tumor in the small bowel with a nodal metastasis in the mesentery.